Hello, everyone. Welcome to the Pet Podcast. And I am your host, Dr. Roberta Westbrook. Welcome to the Campus for All Animals. We're here at the Houston SPCA. And today we have some wonderful, hopefully very helpful information for you. What we're going to talk about today is what do you do when your pet has an unfortunate incident and they need to take medication? Oftentimes, you may be so consumed with caring for your pet and giving your pet the love that he or she needs that it may not occur to you how you're going to get the medication in your pet. And you may be wondering, what's the best way to give my pet medication? Particularly if you've never had to do it. It can be quite a feat. And there's a few tips and tricks that we're going to try to help you with to help you get your pet's medication safely. So think about your questions regarding medication and how they can be administered, and we'll be right back to help answer those questions. But for now, I want you to take a look at one of the wonderful, wonderful dogs we have up for adoption. This is Muriel. She is such an adorable dog, very sweet. She knows how to sit. She knows how to stay. She knows how to shake hands, and she certainly loves treats. She's working on that snuffle mat there. We put some Hills Science Diet treats in there, and so she is working on that. She's so cute, getting some nice belly rubs. Muriel is available here at the Houston SPCA Adoption Center. So this weekend, get your family, your friends, come on down to our campus and take a look at the dogs, cats, puppies, and kittens that we have available for adoption. We have rabbits, and we even have large animals. There's no appointment necessary to come into our adoption center. We do require face masks to enter, but all are welcome. So make a day of it, have some fun, come on out. We'd love to visit with you. Just make it a fun day. So start thinking about your questions about medication, and we can start helping you get those medications into your pet. So I'll start with a few tips and tricks that we've come up with. The first thing, probably most of you all have tried before, and is not going to be a new suggestion. And that's if your pet has to take a pill, oftentimes the pill has a bitter taste. And so they're not going to want to take it probably directly from your hand. You're going to have to try to disguise the pill in some sort of usually stinky, smelly food, fish flavor, chicken, beef, pork, something that's very enticing for your pet. And that's going to cover and mask the smell of the medication. And it's also important that you check with your family veterinarian and make sure your pet doesn't have any food allergies, so that if you're using something other than what they've given you to administer the medication, you're not going to interrupt your dog or your cat's diet. So what you can do is you can take some canned food, for example, and get a little spoon or a tongue depressor, and you can make a nice little round meatball out of that canned food. And then what you've been able to do now is have a nice little pill pocket that you've made on your own. And you can shove that pill right in the middle of the treat and give it to your pet. Now, this is another thing. Some of you guys have really sneaky pets who don't take food right away. They know that you're up to something and they're going to investigate everything you're trying to give them. So what you can do is have a couple of just regular meatballs that have no medication in them. Okay, it's just a regular meatball. Come here, Muriel. Do you want a meatball? Come around. And some medication that has some meatball that has no medication in it. Okay, just like Muriel here. Do you want to sit? Show everybody how you can sit. Sit. What? Sit all the way. My good girl. That's a good girl. So now we've been able to give her that meatball, and she takes it readily. If I need to give her medication, I can shove that pill in the middle there, and she's now so excited about the fact that she's going to get a treat. She may not investigate that second meatball as much. And so if you have a dog that likes to investigate, maybe trick them a couple times with a meatball that's empty, and then put the medication in it. Any questions?
So Cheryl was wondering, when you do hide that pill in the meatball, some dogs are super sneaky. is it okay if you break open some of the pills and then sprinkle it in there, or does it make a difference?
That's a good question. So the problem, if it's a capsule and you break it apart, sometimes that makes it more bitter. Because the reason they put it in a capsule sometimes is because of the way the medication works. It needs to be extended over a period of time. So it could, depending on the medication, affect how it works in your pet's body. But oftentimes those powders are very, very bitter. And since it's in a large amount, it's a powder that now we've mixed throughout the food, it almost makes it more able for your pet to detect it and reject it. So it depends a little bit on the medication and how bitter it is and the smell. It also depends on the medication because it could be in a capsule because it needs to be released over a period of time, and opening it up could affect how it works in your pet's body.
Okay, what about baking? Can you, say it's a liquid and you could pour it into some oatmeal with the meatball and then bake it?
That's a great question. I think that is a good option. Same thing, as long as it gets mixed in well and they can't detect it. Maybe if you've used a recipe that you know your dog loves before, and so they're not even going to be super sneaky about it. There's certainly nothing wrong with that as long as whatever you're baking it in is healthy and safe for dogs. And so another thing that I can say is, in the event that canned food doesn't work, again, there's some other household items that you can use. One of those is peanut butter, everybody's favorite. So dogs tend to love peanut butter. It sticks really well. And so you can coat the pill and the dogs can kind of work on getting that pill down. Peanut butter is a great option. And then spray cheese as well. So you can get canned spray cheese that usually is a wonderful treat for dogs. And so just getting them excited about a treat is really the way to do that. Yeah, look at that. She's so excited about that. And it's funny to watch them because as it gets stuck in their mouth and their tongue, it's a little bit humorous to watch them try to eat that. But can be very, very helpful in helping you get meds down. Any other questions?
Yeah, so Michelle was wondering, she has a super sleuthing pup, and she has said that she uses peanut butter, but her dog will suck the peanut butter around the pill and then spit the pill out. Do you have any recommendations?
They're very, very sneaky, aren't they? Very sneaky your dog is. So yes, if food doesn't work and they're, again, the type to investigate and know that you're up to something, it could be that in a last kind of effort to get the medication in your pet that you have to pill your pet directly. Sometimes we have to do that. Sometimes we have to take the pill. I'm going to take a tiny little pill here, for example, you can't even see it. And you put that pill inside a delicious meatball that you know that they really like. And you can hold their mouth open and just put it in the back of their throat. Now, this is something that you're going to have to try with your veterinarian or a nurse who can help teach you to do this right. We are going to be very adventurous and try this right now with Muriel and see how she takes this little meatball if we had to give it to her directly. So I'm going to walk over to her. Oftentimes it does help if you have a restrainer. And so we'll come down here. Hi, Muriel. And we pet Muriel, and she already is ready. And so what I'm going to do is I'm going to hold her upper jaw, open her mouth, put it in the back of her throat, close her mouth, and she's going to swallow it. You did a great job. You did a great job. You even want some more. So what you want to do is try to hold the upper end of the muzzle. For being such a good girl. Good girl. Yes.
Jackie was wondering about what if there's some sort of reaction like diarrhea, and how do you know that's not the medication, or if it's like the treat that you gave them, like maybe like the wet dog food or the peanut butter?
That's a great question because that can happen anytime you're changing the diet. Diarrhea is a possibility. Oh, she's my best friend now because she knows I have the treats. It's a possibility. Some medications can contribute to GI upset, but also, yes, if you're having to give medication 2 or 3 times a day, and every time you're doing that, you're having to trick your dog with 5 or 6 meatballs and several tablespoons of peanut butter, you certainly could upset their stomach. And so again, maybe see what works first. You can also use something bland. And options that are bland, that are easy on the digestive system, include rice, chicken breast without any seasoning on it. Those things tend to be bland and easily digestible, and oftentimes are not likely to cause diarrhea. But again, talk to your family veterinarian, because if your pet has a history of GI upset or a sensitive stomach, or maybe they have an allergy to chicken or some other animal protein, you're going to have to find different options. Another very great trick that you can find at your local pet store or on Amazon is what we call a pill pocket. So let's say you don't have canned food or you don't want to use peanut butter. They make these nice handy dog or pet specific pockets that are very chewable and soft, and it works just like canned food. You can just shove the pill right in the center of this little pill pocket, we call it, and you can give it just like a treat. And since it smells like bacon, smells like like beef, they usually love to take it, and the pill slides right in. There's a little space in the center there that covers that pill, and so you can give them a test, see if they take it, and then the second time actually give them the doctored pill pocket. So that's another tip. Any other questions?
Michael had a quick question, and I don't know if this really applies for here or not, but you had mentioned earlier about how sometimes the competition when you're trying to, like you've got more than one dog, for example, and you've got to get medication to only one. What happens, or should they be concerned if they do use the meatball or the pill pop, and the one who's not supposed to get the medication wins the game and gets the whole medication and everything?
Yeah, so that can be good and bad using competition. So let's say you have a dog that needs to take the medication and they're not really taking it on their own, but they'll take it if they know that there's another housemate that wants it, right? So you have some dogs who are not really good at eating, but if they know that there's some competition in the house, they're like, well, I might not want this food right now, but if he's going to eat it, then I'm going to eat it first. You can use that to your advantage if you need to administer medication. So what I mean by that is if you know your dog is kind of competitive with food, you can use the doctored pill to get them to take it, and they're going to take it just so that they get that treat before the other dog. But you got to be careful, because if you have another dog that's even more competitive and they're fighting over this doctored pill pocket, you need to be careful about that. So really it's about monitoring and knowing your pack of dogs and knowing how they behave and making sure that you can control the one or the other who you actually want to get the medication. So it just takes a little bit of you knowing how to make sure that you can control them.
I guess we have like one more question in referral to dogs. Is there a point where you need to like maybe ask your veterinarian to switch from a pill to liquid possibilities if you've exhausted all of these and they're just too smart?
That's exactly what I was going to say. If you've sort of tried all of these things and it's just not working, sometimes medications can be formulated into liquid suspensions that are easier to give. So for example, some medications come in a liquid suspension that you can give with a little syringe this way. And oftentimes the tip of the syringe can just be placed in the corner of the mouth and squirt it in. And because it's liquid, it's almost like the patient, the animal, your pet doesn't really have time to get it out of their mouth, right? It's in there, it's a liquid, it's already absorbed. They may not like the taste of it, but it's in there. And so sometimes that really helps to have it in a liquid suspension, and that's an option. In some medications, particularly for cats, you can get the medication formulated into an ointment that gets absorbed through the skin. And that's available for some medications, not all, but there's some medications that can be just as effective if they're compounded as a topical. One final trick, and that is if it is a medication that they can lick off, sometimes you can put the medication or the pill in a little peanut butter on their paw, And as they're licking the peanut butter, they may accidentally kind of take the pill in with them. So that's kind of a little trick as well too. So now what we're going to do is, that's the easy part, right? Like Muriel was the easy patient for us. What if you have a cat? What if you have a cat? Cats can be a little bit more tricky to administer medications to. And so this wonderful girl that we have here is Bagheera. Hi, Bagheera. Come on, Bagheera. We're going to put Bagheera on a towel here. My sweetheart. And she's so cute. She's so cute. She is available for adoption. She's so sweet, an adult cat. She's got some weight on her, so she's going to be great for cuddling. And we are going to see what it's like if we need to give Bagheera some medication. If you're by yourself, or even if you have a helper, some things that we do in the hospital environment is make a little burrito out of our pets. And so we can lay them on a towel, like you see Bagheera here, and we essentially wrap their paws up, because what we want to do is we want to put them in a nice tight little cocoon, almost like a little cat burrito, so that they can't use their paws to get away from us. And so we essentially wrap them up, just like you see here. Lisa's helping us wrap Bagheera up. And she's just wrapping the towel around Bagheera and covering her front paws there, making a nice little burrito there. And so sometimes just their little noses sticking out, and you can have someone petting them. And this can help us do a couple of things. It can help us to give liquid medication, as I mentioned before. So if I needed to give this liquid medication, it's just water that we're giving to Bagheera, and you can just put it in the corner of the mouth. And that's it. She did a great job. And so she swallows that medication and it's in, and we didn't have to worry about her paws kind of moving us out of the way. For cats, this can be used for dogs too. But oftentimes for cats, we have this option. This option is called a pill popper. They're some of my favorite tools. And this is an instrument that can be used to administer a pill to a patient. So it's called a pill popper. The way that it works is it has a little plunger system, as you can see here, little plunger system. And so you take the pill and you put it at the tip of the pill pocket here. Let's see if we can get a little tiny pill out. We're not going to give this to Bagheera. I just want to load the pill popper so that you can see. But if we have a little pill, we stick the pill in the tip of the pill popper. And then we hold the pill popper like this and operate it with our thumb. I can move the plunger with my thumb in and out, just like that. And when I put this tip of the pill popper by the mouth, I'm just going to press on the plunger. Usually when it gets close to the mouth, the pet will open their mouth a little bit, and you just need them to open their mouth a little bit. And then you can just press the plunger, and that pill will go into the back of their throat, and they're oftentimes swallow it. So Bagheera doesn't need this pill, but I can still show you how that might work, where, and you can just hold them very, usually just kind of let them be. Just let them be. And sometimes as you stick something toward the mouth, they'll kind of want to try to want to open their mouth anyway, like that. So she just opened her mouth on her own. She's felt something in the corner. So she's like, hey, what is that? Well, when she opens her mouth, then I can push the pill into the corner of the mouth. So even if I'm petting her, I just put it in the corner of the mouth. She opens it and I press the plunger. And it'll go kind of in the corner to the back of the throat. And usually they just swallow it right down. So this can be a very helpful tool. It may take a couple of tries before you get it, but then I feel like it's very helpful, particularly for cats. So that's a pill popper. They're very cheap, probably $1 or less, and you can get like 5 of them for $1. So really handy tool. Any other questions?
Natalie was wondering if the pill gets in their mouth,
Yes.
and then they spit it out, and it's moist. Is it still okay to be used, or should I get a new one?
That's a great question. It depends on how dissolved it is. So usually I will try 2 times. If after the second time it's all over my fingers because now my fingers are white like the pill, then you may have to use a new pill, which means you could run out of medication sooner than expected. And that means contact your veterinarian, let them know the problem that you're having to use additional medication to get it in your pet, because then it may be time to try a different formulation. Then it may be time to say, maybe we should use a liquid. Maybe we should see if there's another way to compound it. With compounding pharmacies, you can oftentimes get very common medications compounded into a treat. What I mean is they'll take a medication that your pet is on and they flavor it and they'll put it into a solid treat so that you just give it to them like a treat. So if you're having to repill your pet multiple times, it's getting slimy, I would say this might be a time for you to look for alternative formulations.
We've got one final question from Kristen, and she wanted to know if pet meds expire, because sometimes there's some left over and that gets put in the cabinet.
Such a great question. Yes. So pet medications absolutely expire. And on your pet's bottle of medication, it very likely has an expiration date. Use it before the expiration date. Don't keep it around for the pet that you think you might have in a couple of years that could use that medication. Don't do that. And on the same thread, use all of your pet's medication. How many times do we even do this for ourselves? We take medication until we feel better. And they're like, I don't need that anymore. I'm not going to do my last 3 or 4 days. What you want to do is you want to give your pets the entire course of medication that the veterinarian has prescribed. That will ensure that the bacteria, that the fungus, the virus, whatever it is going to actually be killed and eliminated. If you don't take all your medication, you risk that infection coming back because now you didn't kill it all. So whatever's left is just going to come back and it's going to come back worse. So make sure you finish all medication. Don't keep it around to save for later. Even more importantly, don't keep your medication around to give to your pets. So sometimes you're like, oh, I'll just, I took this for pain. I think I might give this to my pet for pain. Don't do that. Medications need to be prescribed by a veterinarian, and they oftentimes have weight limits. And so you need to make sure that you're giving the right amount in the right formulation. All great questions. Thank you guys for joining us. I know there's so much information for us to take in during these Fridays, and medications can always be challenging. Come visit Muriel and Bagheera this weekend at our adoption center. We're happy to have you and see our Campus for All Animals. Thank you guys so much for joining us, and we'll see you next week.